My name's Jennifer Tremmel. I'm an interventional cardiologist at Stanford. I'm also clinical director of our women's heart health clinic, and I do research in sex differences in cardiovascular disease. As a woman and cardiologist, I feel that I have a certain obligation to be a role model for my patients and for other women, and certainly believe in practicing what I preach. The single most important thing that I do to take care of my heart is getting in a run as often as I can. Cardiovascular exercise, we know, is good for the heart. It not only feels good, but keeps me in good shape and is a good stress reliever. One thing that people forget about is that as they get older, they are typically doing less exercise and they actually need to eat less food over time. And as a cardiologist and someone who has tried to keep her weight at a stable level, people often ask, how do you do that? Or they think that I'm blessed or something. But in fact, it's regularly engaging in physical activity and actually adjusting what I eat over time. And like everyone else, I have to eat less as I get older because I'm not burning as many calories and my metabolism isn't as fast as it used to be. When it comes to heart health, no one's perfect and we all have some bad habits. And I would say that I certainly suffer from that as well. I don't always get as much sleep as I should get, and I have a slight addiction to Diet Coke, which isn't good for me. But I try to do the best I can. I think one of the great ironies is that everyone knows that diet and exercise are good for their heart, but they still don't do it. And a lot of people come into the office and they're looking for a natural alternative, and they don't want to take drugs and they don't want to have tests. Actually, just today, my mother emailed me about a particular diet system and wondered if she should be doing that. And I reminded her about regular old heart-healthy diets and exercise, and she wasn't very pleased with my answer. Just because I'm a cardiologist doesn't mean that I'm immune from all the things that my patients are struggling from. But taking a little extra time and being very conscious about what we put in our mouths is important. And this is for the rest of our lives, and so we need to take the time to do it.